It will be tabled. Question number 6, the Honourable Annette King.
Thank you, Mr Speaker. My question is to the Minister of Health. What advice, if any, did he receive on the Better Public Services seed funding social bonds pilots?
The Honourable Dr Jonathan Coleman.
Mr Speaker, I've received a wide range of advice from Treasury, SSC and the Ministry of Health, and I've got a feeling that I'm about to receive some more advice from the member.
Supplementary question.
Supplementary question, the Honourable Annette.
Why has he not released the KPMG reports into social impact bonds in light of the United Kingdom Peterborough prison pilot, which his government called a world leader, but which was cut short and investors did not receive a return on investment for the full contracted period?
The Honourable Dr Jonathan Coleman.
Well, Mr Speaker, I think that's very much the point. If these programs, social bonds, do not deliver results, the investors don't get the return. So there is no risk for the government because we're contracting for results and we're saying we will pay when the results are delivered. If that happened in Peterborough, I presume the provider wasn't delivering. End of story.
Question, Mr Speaker.
Supplementary question, the Honourable Annette King.
Why has he chosen mental health sufferers as guinea pigs for the government experiment when the pilot program, costing at least $1.13 million from the health budget, did not recommend mental health for social impact bonds, and the internal affairs report commissioned by them, which the minister quoted, but not all of it, said not to engage in trials or implementation, but to monitor overseas experience?
The Honourable Dr Jonathan Coleman.
Well, look, Mr Speaker, the first thing is these are social bond pilots. The second thing is we have not shied away from striving to achieve results in very difficult to make progress areas. So that's why, with mental health clients, we are determined to help them get back into work where appropriate. And I think actually the Labour Party should be getting behind this and actually giving us a pat on the back, because we are going to contract for outcomes that will make a real difference to the lives of mental health patients. And I'd ask, what is wrong with that?
A supplementary question, Barbara Stewart.
Thank you, Mr Speaker. Does this move not show a clear privatisation agenda and a move towards an initial public offering, as reported by Bloomberg in an article today?
The Honourable Dr Jonathan Coleman.
No.
Honourable Annette King, supplementary question.
Has anyone told him that funding for NGOs providing mental health services in the community has not increased for at least the past 5 years, and this latest harebrained scheme is nothing more than privatisation dressed up as social investment?
That's right.
Well, Mr Speaker,
the Honourable Dr Jonathan Coleman.
what they have told me is that under this government, the funding is actually delivering better results than ever. And unlike under the last government, where they poured in more and more money but delivered no results, we are actually making sure that money is guided where it's needed, and we're measuring results, and this is part of that. We're not going to pay unless we achieve a result. I know it's anathema to Mrs King, but that's the fact.
That's right. A question, Mr Speaker.
Supplementary question, the Honourable
Is he aware
Annette King.
that the barrier to getting mental health sufferers into work now is prejudice? And so how do social bonds paying a profit to private investors change that prejudice?
The Honourable
Well,
Dr
that's
Jonathan
very much
Coleman.
the point. There is prejudice, so we have to use innovative means to actually overcome those barriers. The member would prefer us to do nothing because actually she doesn't care about employment outcomes for mental health clients. We do.
Mr Speaker.
Supplementary question, the Honourable.
What is correct when he said that social impact bonds will focus on an area where the government is not currently active, quote, so actually we're not getting employment outcome for people with mental health problems, or when he said in the same interview, there's been a very successful program run partnering with an NGO to get people with mental health issues into work. It's working.
Well,
the Honourable Dr Jonathan
listen to
Coleman.
the context of the whole interview. It all is correct and it all makes sense. Go and have a listen to it again.
Point of order, the Honourable
I didn't think that was an answer. Just go and listen to the interview is hardly an answer.
Order. The member now needs to listen to the answer that was given. The question was, which is correct, and the Minister answered by saying both statements were correct. Well, that's the need for further supplementaries. Question number 7, David C.